Well, good morning, good afternoon, everyone online. Welcome to today's webinar titled Iran's Welfare System Towards an Integrated Social Protection System for Children and Adolescents. My name is Charlotte Bilo from the International Policy Center for Inclusive Growth. It's my pleasure to be your moderator today for this webinar that is hosted by socialprotection.org and organized jointly by the Ministry of Cooperative, Labor and Social Welfare of the Islamic Republic of Iran, UNICEF Iran, and the IPC-IG. Before we start, I would like to remind everyone online that interpretation is available for Farsi and English on your Zoom screen in the interpretation button. And few words about today's webinar, the content of today's webinar. We will have 3 short presentations from our colleagues from the ministry in Iran about the social protection system with a specific focus on policies and programs for children and adolescents in Iran, and a particular focus on the Iranian Welfare Database. So we're very glad to have 3 speakers from the MCLSW with us. And after the Iranian presentations, we will have a short Q&A. So I would like to remind everyone online to send their questions through the Q&A box, and then we can share them with the speakers. After the presentations from Iran, we will have a short presentation from UNICEF Jordan on the National Unified Registry in Jordan. And at the end, last but not least, some reflections and a short presentation from UNICEF MENA Regional Office and their work on integrated child-sensitive social protection policies and systems in the region. Now, let me introduce the speakers. Thank you. So we're very honored to have with us today the Deputy Minister, Mr. Abouhamzeh, the Deputy Minister for Social Welfare of Iran, as well as Mr. Rostami and Ms. Mirmalek from the MCLSW. And we're also very happy to have our UNICEF colleagues, Mr. Robin Nandy, the UNICEF Iran representative, as well as Mr. Samman Thapa from the regional office, and Mr. Manuel Rodriguez from UNICEF Jordan. Again, I'd like to remind you all to send your questions through the Q&A box. And if possible, please also let us know to whom your question is directed. As mentioned, we will have 2 slots for Q&A in the middle and at the end. And without further ado, I would like to give the floor to the Deputy Minister. Deputy Minister, please, the floor is yours for 20 minutes. Thank you.
Can I actually share the file? Do others actually see the PowerPoint? I'm just checking whether everyone can see my PowerPoint.
We cannot see the PowerPoint yet. Great. We can see it now. It just needs to be in full screen mode.
In the name of Allah, the Merciful, the Compassionate, I would like to extend my greetings towards each and every single one of the distinguished participants, those who are with us physically and those who are in the meeting virtually. I hope that the presentation that I'm going to provide, you would find it useful. As you can see from the title, in this very short presentation, I'm trying to actually present for 20 minutes. We will be talking about an overview of the social protection system in Iran, and it will of course be focusing on the protection, the social protection that we render to children and adolescents. First of all, let's actually talk about the structure of social protection in Iran. In order to have a review of this system, let's talk about actually the rights which have been envisaged and stipulated in the Constitution of Iran. There are many provisions about the different rights of the different citizens inside this country, and you can see the title social assistance and security as a universal right, the labor rights, of course, uh, concerning women and children in terms of education, and of course, housing and accommodation. And these are, of course, the details of these rights that have been stipulated in the Constitution. If you look at women and children, you will see the statements, provisions are. It's actually good if we just read them very quickly. The government must ensure the rights of women, create a favorable environment for the growth of women's personality, the protection of mothers, particularly during pregnancy and childbearing, and the protection of children without guardians, and the provision of special insurance, widows, older women, and women without. It very much seems that the different sectors of society who need special support, um, children, and also specific groups of women or any other groups, we have actually specific reference to them within the Constitution. Uh, the truth is about education and housing. We're talking about general education, which would be free of charge, and also supplementary education. You would be able to see for yourself within the provisions of the Constitution. Based on the Constitution of every country, of course, these comprise the master document, if you like, for the legislation. In 2004, there was the Structural Comprehensive Welfare and Social Security System law, which was considered as the basic legislation in terms of social welfare. And of course, the objectives of the social security system were pronounced in that legislation. And there was, of course, attempts made to try to find the interactions among the different stakeholders and beneficiaries inside the country in order to remove any kind of lack of coordination. As I noted, social protection has is probably has actually a history of about 20 years. Again, all the actors and players and stakeholders who could actually play a role in the different layers of social protection structure are incorporated. There's also further institutionalization according to this legislation so that we have more harmonization of the efforts and endeavors made by these different entities. We have three major levels within the social security system. The first is, of course, the universal insurance, social insurance, which is universal, including retirement, employment, accidents, disability, life and health insurance. These are the different kinds of insurance that people need. The other layer is, of course, social assistance and rehabilitation, which include the granting subsidies and financial aid to individuals and families in need. And the third layer would be the emergency response vis-a-vis natural disasters, for instance, or other kinds of disasters. Generally speaking, in that legislation, these three layers of assistance, they have been defined. They're defined clearly as well with respect to the very specific duties and tasks. Based on the provisions of the Constitution and also the structural legislation, which is the comprehensive law that is, and of course the upstream documents that exist in terms of protection and assistance. And of course, in the interest of time, I would not be able to talk about each and every single one of them in this presentation. But there is an overall architecture for the implementation of a social protection system that we will go through them together. Now, some of the major institutions which are involved in social welfare, they're part of the government, the executive branch, that is. And we have three, of course, major institutions that I could name. First and foremost, uh, it is a Ministry of Cooperative, Labor and Social Welfare. This is actually the ministry that we are stationed in. We have actually the deputies of social protection, and we have other institutions and other organizations which are affiliated with the ministry. The other very important institution which exists within, and it is defined within the comprehensive social protection law that I talked about, is the Supreme Council of Welfare and Social Security. This Supreme Council is actually uh, presided by the president, and there are also a certain number of ministers who are members of this Supreme Council. Um, the other very upstream institution, which is a very important role, is actually the Department of Planning and Budget and the Department of Targeted Subsidies, which is affiliated and is a subsidiary of the Planning and the Budget Department. We know, you might know that we have different subsidy policies, and the one which is actually more comprehensive than others is the payment of cash subsidies being paid to over 76 million people. And we have, of course, a social security that covers about 44 million people, and we have the welfare department, and we have the pension fund, and also the national health insurance department that cover different citizens. Some of them they provide health services, some of them retirement services, pension services, and some of them provide services for vulnerable and or impacted individuals or disabled people. There are other institutions which are governed by the Office of the Supreme Leader, such as the Alavi Foundation, Barakat Foundation, also a very important institution which has an important role for providing assistance to the poor. It's the Khomeini Relief Foundation. It actually covers about 1.5 million individual beneficiaries. And, there are also a number of those who have referred to this foundation and in order to receive assistance. They're, so to speak, in the waiting list. Now, more briefly put, if we want to talk about the social system in Iran, we have different kinds of protection provided in different colors, as you can see in this slide. You have the education, which is in blue, unemployment, healthcare, and also the insurance services, social health, and the infrastructure and housing. They are all, they can also be considered one by one in order to have a general scheme of what is happening based on the budget plan, which is presented every year and approved by the parliament. You see actually the different institutions which are responsible for service provision, and each of those institutions must present a different program, and you can see the generalities of these programs. And in order to actually get more light and make it more transparent, the blue parts they've been actually extracted from the budget policy, and of course the credits that they receive in order to provide the services, especially in terms of education, which is of course, as I said, in blue. I think the gentleman is looking for a laser point. Yes. As you can see, for example, in this circle, the sector are, of course, the prisoners who are in need of training courses, who are actually requesting training courses. And the Department of Penitentiaries, which is an institution in Iran, is actually responsible for state prisons and security, correct measures. They are actually responsible for providing training courses, and of course, this has been stipulated within the budget document. You can see other examples. Well, again, in the interest of time, I'm not going to give you more examples. Just one more. For instance, those who are living with disability are within this category, and the Ministry of Education has a specific institution for education for students with learning disabilities. Again, in the interest of time, I'm just going to passes. Those who are actually interested in seeing more detail can refer to the presentation.
In the next slide, we'll review of the protection policies, which is targeted towards children and adolescents. In this regard, because it's a very important issue in our country, we have an upstream law and document in order to protect this part of the population. I will go into the details of that later on. Here we have some budgets allocated. I will just show you a small picture that would show the kind of distribution of that between different kinds of agencies. Here we have Ministry of Cooperation of Labor, which gets 27%, Ministry of Education 35%, Imam Khomeini Foundation 6%, and we have also 32% titled under miscellaneous spending. And the budgets that go to the Ministry of Welfare is distributed in this manner. The cash transfer is around 54%, social health 13%, education 25%, and sanitation and health get 8% of this budget, which is given to the Ministry of Cooperatives, Welfare, and Social Welfare. Well, we have the generalities, which was explained in the previous slides, but in the budget document, in fact, because we want these targets to be met, we have the programs there, we have the plans, and also the target population which is supposed to be benefiting from this is identified. Here we have the details of that broken down. Like, for example, here at this level, we have the Ministry of Education, which is an organization that is responsible for, say, helping people with learning disabilities, and the target population was 900 people with learning disabilities. And the different levels and different programs and different parts of the population are mentioned here. Later on, you can just have a look at that. Also, I did say that we have an overarching law for protection of children and adolescents, and the aim is that all the rights of this section of the populations which might be trampled on, which might not be taken care of, they are identified, and each of the organizations and the agencies, they have their own mandates in order to act in this regard and make sure that these rights are upheld. According to Article 3, for example, of this law, if a child or adolescent is exposed to harm as a result of school dropout, economic exploitation, violence, negligence in providing basic needs, illegal development, employment, hazardous work environment, or any issue that impact the physical, mental, or social development of children, to legal intervention and the protection of children and adolescents. According to this law, as we see, if they're exposed to any harm, be it because of the environment they work in, or they have been exploited, or they have been exposed to violence, these are taken care of in this law, and different agencies, they have their mandate to act according to the issue. Besides that, within the past 2 years, while we had the COVID-19 pandemic, we had different kinds of programs in our ministry, and we suggested and we offered that to the government, and I will just go through them one by one, or some of them at least. The first policy that we kind of tried to implement was offering low-interest loans, 1 million tomans in amount, to low-income households, which as low-interest loan, less than what you have at the banks or in the market, and 58% of these households had children, and because of the low income, they were very vulnerable to different kinds of harms caused by the COVID-19 pandemic. Some of them might have lost a member of the family or a parent, and some of them were exposed to economic harm. For example, because of COVID-19, the father wasn't working and their income had been reduced. Another policy was to have an unconditional cash transfer program for the amount of 200,000 to 600,000 tumans to low-income households, and 42% of these households, as I said, had children. And there were 2 or 3 more programs. Some of them were in UNICEF, which was like rolling out a Cash Plus project, and there was another program for the distribution of hygiene kits to curb the spread of coronavirus in collaboration with UNICEF again. There is another very important policy followed by the Ministry of Welfare. It was the protection of the children who are not Iranian citizens and they are here as immigrants or as refugees. On the whole, we have 490,000 non-Iranian students, of which around 466,000 are Afghan nationals. And these people have the same rights as the Iranian children as far as education is concerned. They are enrolled in state schools, and there is no discrimination between these children and Iranian children. And here we have a graph that shows the statistics, related statistics. Here we have non-Iranian students by country of origin. You will see that 95% of them are Afghans and 5% are children of other nationalities. And here we have the distribution of rural and urban distribution, and 27% rural and 73% urban students or students studying in the urban environments. Here we have the gender ratio of non-Iranian students by level of education. In the elementary, we have 53% boys and 47% girls. In lower secondary, 53% boys and 47% girls, and the rest. Well, thank you for your attention to this presentation. Well, I hope that I haven't gone over the allocated time, and if there are any questions, I'd be happy to answer them.
Thank you, Deputy Minister. Thank you very much for this very comprehensive presentation. I think showed very clearly the commitment of Iran to providing social protection to children and adolescents. Again, if the audience has any questions, please share them through the Q&A. I would now like to hand over to Mr. Rabi Nandy, the UNICEF Iran representative, for his opening remarks on behalf of UNICEF. Mr. Nandy, the floor is yours for 5 minutes.
Okay. Can you hear me now?
Yes, we can hear you.
Thank you, Charlotte. As UNICEF representative in the Islamic Republic of Iran, I'm very happy to participate in this webinar and would like to acknowledge the effective and long-standing cooperation that we have had with the Ministry of Cooperatives, Labor and Social Welfare and its implementing arm, the State Welfare Organization, to strengthen the national system for better welfare of children living in Iran. The presentation made by Deputy Minister Mr. Abouhamzeh provides a succinct overview of the scope and scale and complexities of the national social protection system in the country. I hope everybody got a sense of the inclusiveness of this system, particularly for the most deprived children, those with disabilities, Afghan refugees, and so on. This is extremely an impressive and ambitious program under the leadership of His Excellency, the Minister Abul Maliki, to support the most vulnerable households and children within these households. UNICEF is very privileged to continue our long-standing collaboration with the Ministry of Cooperatives, Labor and Social Welfare, and to strengthen, to help strengthen the already very strong social protection system, particularly with regards to life cycle targeting, so that children of all ages, irrespective of where they live, benefit from the social protection system. You will hear more about the life cycle targeting from my colleague, Mr. Samman Thapa, who will speak later in this webinar. But just as an introduction, in simple terms, we are talking about better targeting of social services to the needs of children in particular age groups. So, for example, in the first 1,000 years of life, the priority is on nutrition interventions. The second year of life, we want to make sure that they are completely vaccinated and receive all their immunizations. For school-going children, we want to focus on out-of-school children and to make sure that they complete their education. Just a few examples here, but you will hear more about that. The other important piece here, colleagues, is the importance of the system being shock responsive and able to withstand shocks such as pandemics, epidemics, and so on. I don't think I need to say much more about this. Deputy Minister already talked about the impact of the COVID-19 pandemic. We are just coming out of the impact of the COVID-19 pandemic. And I think we have learned some really important lessons during this period that we need to consider. Because one thing that we can be sure of, that the COVID-19 pandemic is not the last shock that the world will experience. There will be future shocks down the road, and we need to make sure that our social protection system withstands and is able to survive, despite these shocks. UNICEF Iran has also been very pleased to mobilize the technical expertise of the International Policy Center for Inclusive Growth in Brazil. This is a world-renowned center of excellence for social policy, and through them, we have helped to share with us best practices from Brazil, from Brazil's Bolsa Familia program, and also learning from the poverty eradication strategies in China. We've also been able to mobilize the support of the government of Austria to roll out UNICEF's globally tested Cash Plus model in selected provinces, with the idea to scale up in other provinces as well. The importance of this, I can't state strong enough in terms of enhancing the national vocational and technical training system for smooth transition of what we call learning to earning. The ultimate aim of this program is to enhance the human capital of the Islamic Republic of Iran, benefit from the demographic understanding that the demographic dividend will not last forever, and we need to act now towards greater economic development of the country. Finally, just so that everybody is aware that UNICEF is in the process of development of its new country program of cooperation with the Islamic Republic of Iran. This will run from 2023 to 2027. The aim, as we design this program of cooperation, is to build on our experience, our long-term cooperation with you, to basically enhance both the breadth and depth of our collaboration. In parallel to this, the United Nations system in the Islamic Republic of Iran is also developing the development framework of all UN agencies support to the Islamic Republic of Iran. Within this overall framework, UNICEF co-chairs the Resilient Economies pillar with our sister agency, UNDP. And we look forward to working with UNDP and all the other sister agencies in the Resilient Economies pillar towards enhancing the social protection system. This will involve providing technical assistance, facilitating, mobilizing required resources, expertise, partnerships, very importantly, facilitating cross-country collaboration, both to showcase the national success of the Islamic Republic of Iran, but also learn from experiences of other countries and how we can incorporate that to strengthen our system. Towards this, we look forward. We've had discussions with colleagues in the Ministry of Cooperative, Labor and Social Welfare to host an international social protection conference jointly hosted by the Islamic Republic of Iran and UNICEF, and we look forward to that support. So I'm going to stop here and look forward to the session and look forward to hearing from esteemed colleagues who will present later in this session. Over to you, Charlotte. Thank you very much.
Thank you, Mr. Nandy, for these really nice and opening remarks, and great to hear what UNICEF Iran is doing in Iran. So I believe we will now see a short video. So if colleagues from MCLSW can share the screen for the video, which is a video of the Rat Al-Gahdi's call center, providing services for children with disabilities.
Bottle caps don't seem like much, but give enough of these to the Rad Al Ghadir Charity Institute, and they'll donate a wheelchair so that she can sit and knit the fabric of her life, and his family won't fall apart at the seams.
The Rad Al Ghadir Charity Institute, which offers free services, was established 17 years ago in order to train disabled people without mental disabilities who have restricted movement, and has been serving them ever since. The Institute has rehabilitated and trained more than 2,500 people and has found jobs for 700 so far.
More and more online businesses are now hiring persons with disabilities who aren't offered jobs outside. People like Ilham.
People like us won't be hired elsewhere. I was able to get more out of my life due to my job here, and becoming independent was the best part.
And now 40 entrepreneurs are discussing how to create more jobs for persons with disabilities. The government should do more as well, says Masoumeh Farahani, the PR manager of the Charity Institute.
Certain rules have been passed to facilitate the employment of persons with disabilities, but should be taken more seriously and implemented in the society.
Many talked of their success.
I take part in wheelchair basketball. I gained the second and third places in wheelchair tennis. I also gained the second place in badminton.
Success stories too grand to be framed.
I was so happy when one of our sweet girls with dwarfism, after having worked here for 2 years, money and buy a car. I was so happy.
And their progress continues to make him smile one masterpiece at a time.
From supporting businesses to creating art, they can do it all. Now, will we facilitate their active participation in the society, or will we deprive ourselves from their contributions? The choice is ours. I am Azacher, Press TV, Tehran.
Thank you, colleagues, for sharing this video. I would now like to hand over to Mr. Rostami, the Director General for Iranian Welfare Database Office, for his presentation on the Cash Plus scheme. And maybe Mr. Rostami also wants to add a few words on the video that was just shown Thank you. Mr. Rostami, you have the floor for 15 minutes.
In the name of God, I would like to extend my greeting towards our distinguished colleagues from UNICEF and also the Deputy for Social Protection from our. I would very much like to thank our friends and colleagues in UNICEF for providing me this opportunity to share with you our experiences in the Deputy of Welfare in terms of the data. And I would also like to thank the Bureau of the Social Welfare Studies, and I would like to thank the Director General for his continuous support in the last few years in terms of the studies and also the managerial dashboard which have been provided. He's always been ready to provide us help and assistance in these contexts. And of course, through the collaboration of other institutions, including UNICEF, they could help and assist us. I would like to take advantage of this opportunity and express my gratitude towards Dr. Mustafi, the Director General, and UNICEF. I have limited time, therefore, very quickly, I would like to actually talk about the database and the experience that we have in our sector. And of course, I will give some explanation about our collaboration with Al Ghadir, the charity that you just saw the film about, and the beginning, the launching of this welfare database. I guess we're waiting for the slides to be shared.
Yes, colleagues, we can see the screen now. While we get the screen on, I would just like to remind the audience to share any questions in the Q&A box. After these presentations on the Iranian system, we will have a short slot for Q&A, so please feel free to post your questions.
من عذرخواهی می‌کنم بخاطر وقفه‌ای که به وجود اومد.
I do apologize for this wait. The experience of the welfare database goes back to 2004 when it was launched. And of course, it had a lot of ups and downs, if you like. But since 2013, we have been able to work seriously within the ministry. This welfare database was founded and established. And right now, we have 60 collected data sources with over 500 information fields. They all have been pulled. This information consists of the assets of every household, such as the cars, the proof of residence, the banking information, which is actually on the balance at the beginning of the period and at the end of the period, and the average deposit, and also the transactions are to do with bank cards ever since 2016. And of course, we have the income information through social insurance, social security departments, and also the different funds, government funds, and other expenditures such as foreign travels. They all have been put in different ways within the state, and there are coefficients for households. They have been sorted, and we have been able to actually have a social profile, an economic profile for 27 million families. The method which has been implemented for pooling of the information is actually the replication procedure. Two data sources use this method, and the information is updated every day. We haven't reached the level of maturity to be able to update them on the system. Therefore, the information is actually exchanged through files. And one of the deficiencies that we have is that we have never been able to have the simultaneity of the exchange of information. And of course, when it comes to dating, there is always a procrastination within certain institutions. Once the data is full, then we have the quality control, and of course, we review it in terms of quality control. The best information that we have are to do with the law enforcement and also the central bank, which have the least error possible. And if we have any errors, it's because the national ID numbers have been missed in some institutions, for example, in the post company and also the entrepreneurship fund, because the information is not connected to the national ID. Therefore, there is there was a stronger pitfall in this regard, and we need to identify the information through different procedures. The applications that we have from this welfare database. First of all, identifying the subsidy target groups before 2019, the cash subsidies were paid to all Iranians, but ever since 2019, with the completion of the welfare, the three upper income debts have been identified, and about 60 million people are covered by the national nationwide subsidy. This was the first time that we were able to actually identify this program based on the data. The second application is the eligibility testing. Dr. Abouhamzeh talked about the support programs. Of course, there was a variation between 2 million to 32 million in the target group, and we were able to identify them both during the COVID-19 pandemic, that we provided 4 rounds of protection, and recently again we were able to identify on 3 rounds the vulnerable layers of society and provide support and assistance to them. There is also eligibility testing for the health insurance, the national health insurance. We started a plan in 2015, and 14 million people who lacked the health insurance, they were covered free of charge by insurance. But after that, since 2018, we started identifying those the high income groups in this regard. And of course, ever since 2019 and the COVID-19 pandemic, because some families were vulnerability, and the deletion and elimination of the insurance pack coverage problems for them. We stopped this program momentarily, and of course, we will be able to follow up through in the post-COVID-19 era. Then, of course, we have the eligibility testing of the individuals covered by social assistance organizations, and the information that we are providing, of course, through, for example, Imam Khomeini Relief Committee. We realize that there are up to 30% error in this regard, and the collaboration that we started doing with Imam Khomeini Relief Committee was that we would get the monthly information of the families which were covered for such assistance. They would, and of course, there would be it would be cross-checked with the information of the ministry, and those who are in higher income deciles, the money would be returned to these institutions. About 7% of the institutions which are covered by these institutions are not eligible for such support. And of course, there is disagreement in this regard.
در نظر داره متاسفانه با هم یه تفاوت‌هایی داره که ما به خاطر اون این 7% رو اطلاعاتشون رو دادیم که کمیته امداد باز اینها رو مجددا بررسی کنه. برنامه دیگه که ما تونستیم از این پایگاه استفاده کنیم در واقع دانشگاه‌های کشور دو تا از اطلاعات مربوط به فارغ التحصیلان دو دانشگاه کشور رو از وزارت علوم گرفتیم و رشته‌های مختلف رو طبق این پایگاه ما مورد ارزیابی قرار دادیم و خب ما خیلی جالب بود متوجه شدیم که خب رشته‌هایی که مثلا رشته‌های مالی یا در واقع بعضی از رشته‌های حسابداری درصد جذب بسیار بالایی دارن تو بازار کار، تا 96% اینها در بازار کار جذب شده بودن. بعضی از رشته‌های مهندسی مانند معماری جذب بازار کارشون تقریبا هول و هوش 20% بود. وقتی ما این اطلاعات رو به وزارت علوم دادیم برای اونها بسیار جالب بود که بر اساس این اطلاعات میتونن در واقع سیستم آموزشی خودشون رو یه بازبینی انجام بدن و بتونن هم به اطلاع خانوارها برسونن که در واقع
Sorry, my apologies. I was on the wrong channel. The gentleman said that they'd used this system in order to monitor the employment of university graduates, and the fact that it was very interesting for the Ministry of Higher Education to know that, for example, in certain fields like in architecture, 20% of the people had entered the job market. We were able to kind of identify the majors that's kind of where the students ended up in the job market, and the Ministry of Higher Education were kind of revised their plans and programs in order to in the universities, and they also returned some more information to us. Another program that we kind of pulled up, and it was actually done in the research office of the social protection, was providing key performance indicators according to the geographic position and cross-checking that information with the postal codes, and we came up with a lot of different kinds of maps when it came to education, when it came to residence. We divided that into different municipality areas and also different provinces. We are finalizing these dashboards, and these dashboards will be given to policymakers in the provinces, and based on this database, they will be able to monitor the situation in their provinces and use them in their plannings and policies. And also we have a socioeconomic profile for all the families and also all the households which are registered. And based on our legal mandates, we would be giving this profiles to different social protection organizations and also charitable organizations who want to help the people in the first three deciles, income deciles. They would be able to extend these protections to these people. One of the one of the things that we have been able to do using this database, and which is the first actually data-based program, was identifying the students who were not in school, out of school children. And for the first time, it was the program was kind of performed by using this database, and we knew that we had around 1 million children out of school, and for the first time we kind of cross-checked this information. The children in our database and all and we're missing in the databases of the Ministry of Education were identified as out of school, and we, through using their national codes and ID codes, we were able to find their families, and in collaboration and cooperation with other organizations, we managed to find the telephone numbers of these people, and the information was given to charitable organizations and like Al Qadir organization. And actually one of our areas of cooperation with them was in this out of school children, and they got in touch with their families to find out why they were not going to school, their children. And the reasons that emerged was that children had kind of physical problems and had disabilities, or they were far from schools. Sometimes some of them had gone to religious schools and the families because they didn't believe in public education. And finally, out of this 126,000 children identified, 26,000 children, their families, they said that the main problem was poverty. And this was actually a first step for us to kind of cooperate and collaborate with the charitable organization and give them the information of these families so that they'll be able to extend the necessary assistance to these families and bring these children back to school. And this was in fact, the first step, as I said, that later on, we also kind of connected this to plans to bring children back to school or back to schooling during the pandemic, because during the pandemic, some of the children didn't have, let's say, the necessary devices, the tablets or the mobile phones. And this was also taken care of to some extent. When it comes to the legal aspect of the situation, Dr. Abouhamzeh talked about this. We had Article 30 of the Constitution that says that education is free of charge for the K-12, and the Ministry of Welfare is mandated to engage all the other agencies, like, for example, Ministry of Education, Health, and also the Ministry of Housing in cooperation with each other in order to kind of make up for these shortcomings. And there's also the law that is for the protection of children and adolescents and gives the Ministry of Welfare the mandate to extend protection to children out of school and prepare the return or pave the way for the return to school. In fact, after the COVID-19 pandemic and the closing down of the schools, people started, and most of the schools, actually all of the schools went online and started using online systems. And with cooperation with the Ministry of Telecommunications, we realized that around 3 million children didn't have tablets or the phones or SIM cards, so that in order to take part in the classes, some of them used their parents' cell phones, but unfortunately, because there was this coincidence of school time and the working hours of the parents, this created a problem. And one of the very valuable things that we did in our research office was that to kind of arrange for the purchase of laptops or tablets and cell phones so that these children would be able to take part in the classes. I will get into the details of that later on, and Mr. Mousavi will also talk about more technical details if necessary. The structure that we had in order to take care of the children out of school was as such. You know, there was this kind of a common committee or mutual committee between the Ministry of Education and Ministry of Cooperatives and Welfare, and the information is gathered from the Ministry of Education, and we cross-check it with the registration organization data, and after that, the kind of purged data would enter the database for the socioeconomic database of the households. It's uploaded in our system, and different charitable organizations have access to this database in the provinces also, and they would be able to use this database in order to kind of have access to the information of these children, and also be able to get in touch with them and with their families based on the province that they are in. They would be getting in touch with their guardians or their parents, and actually they would try to meet the needs of the children and come up with the necessary protection program. Right now in 3 provinces we are doing this. We are rolling out this program, and with the help of UNICEF and cooperation with UNICEF. And if we have bank account numbers, we kind of transfer money to their accounts, or sometimes we get in touch with the school, and then they give us the information or the bank account numbers, and we give them some additional, let's say, cash transfers. The money is transferred through Ministry of Education and the working group that they have. They check whether the child is in school, and if they continue sending their children to school, they would be receiving further cash transfers. There's also another program when it comes to children and their mothers, and also pregnant women, which is taken care of by Ms. Mirmalek and her colleagues at the Empowerment Office, Support Affairs and Empowerment Office of the Ministry. I hope that our actions and measures and our experience would be also useful to other countries. Now I will give the floor to Ms. Mirmalek. The lady is the Director General for Support Affairs and Empowerment Office.
Thank you, Mr. Rostami, for this really insightful presentation. Yes, so we can see now the screen. Ms. Mirmalek, the floor is yours for 15 minutes.
In the name of Allah, the merciful, the compassionate, I would like to extend my greeting to each and every single one of you, distinguished participants in the webinar. Again, I would like to extend my greetings to all the distinguished participants and also others who are with us virtually. As Dr. Abouhamzeh and also my colleague, Mr. Rostami, we have been discussing, of course, the different discussions about social protection and also the issue of the welfare database and, of course, out of school children, which was discussed. The other point that I'd like to share with you in this limited time is actually food security for children and pregnant and lactating mothers who are suffering from malnutrition. This is, of course, a very important issue, which has always been a major concern for the government of the Islamic Republic of Iran. This program is to do with a reduction of food poverty and all the issues related to it. Of course, this has a very long and rich experience, but I would like to focus on it ever since 2004 that the ministry was established. Of course, all that we have done in order to reduce food poverty. And of course, following this, she's trying to go to the next slide. Okay. As I was saying, the issue of food security has always been emphasized by the Islamic Republic of Iran, and there are, of course, different provisions and laws within the upstream documents that we have, which all underpin what I'm talking about. We have a constitution, we have the 2025 outlook for the country. We have also documents on the general policies of health and general policies of resilient economy, and the most recent legislation which has been adopted for regarding food security for children and pregnant and lactating mothers is the population, the demographic document for population youth. Could you? She's asking for the slide to be changed. Right. As you know, the samples that we have in this slide are the ones that I just talked about. These are the provisions, of course, which are well noted, and the government is mandated. The Ministry of Cooperative, Labor, and Social Welfare is one of the major stakeholders in terms of poverty reduction, specifically also in terms of food poverty reduction. This has been always followed up. It's one of the major plans of the ministry, and of course, it is the deputy of welfare within the ministry who has to follow up on this. As I noted, this is what we've been doing since 2004. Ever since we have the targeted subsidies legislation and it was adopted, what happened was that we had the fragmented initiatives which were about food poverty alleviation, they were pooled and aggregated within the budget law of the country. And of course, we were able to follow this more readily and to ensure that everything is happening in an integrated, harmonized fashion. This was actually underway, and we, of course, needed to identify the target groups, and based on the research which was conducted, and of course, this is what international community's very first target of malnutrition as children, especially children under 6, we are, of course, faced with our mental development and the growth and development, which is to do with our body as well. Regarding the importance of the issue, the first target group were children under 6. And again, with respect to the significance of the pregnancy and the lactation period, therefore, the pregnant and lactating mothers were included within this initiative. So next slide, please. As I noted, that when the targeted subsidy legislation was adopted, the subsidy on cheap food was removed, and of course there was this extra burden and pressure on poorer families. And then there was this legislation that any law or legislation which could detriment or have a harmful impact on the poor layers of society following the targeted subsidy legislation should be compensated through the targeted subsidy legislation. And this is what's been following up in this regard. And now the target group has been identified. Another milestone was very successful was actually integrating this in the, accordingly, we couldn't have an institution, protection institution, the welfare department, the need relief committee, and all others, and also the NGO that acting in fragmented manner. Everything was pulled and harmonized and integrated with respect to the circumstances and the goals that we were seeking. Next slide, please. Before I start talking about the examples, as of course the title of the webinar tells us, we are introducing the social protection system, which are which are being conducted in an integrated manner using the welfare database. My colleague, of course, introduced the database adequately. But before I start talking about identifying the target population, allow me to just state, before we start the identification process, we engage with the Ministry of Health and Medical Education. Since the Ministry of Health, and with respect to the health centers that have in the cities and provinces, they have an easier access to our target population. That is why we ask them to tell us which groups of people we could actually do the cross-checking with. Ministry of Health, with, of course, respect to the portals that they have, and also the profile, the health profile that they have, and also the growth card that they have, for surveillance of the group of everything. They identified the children based on the formulas which have been approved by the WHO or World Health Organization, or other standard instruments. They identify them for stunting and for low weight, and of course, these procedures. We have the national codes. They actually put national codes, and we use these national codes. We check them with the Iranian database. Next slide, please. Now, next slide, please. In the next slide, we are actually talking about the entire process. We have a scheme of the identification of children. Once we actually, as I said, we cross-check them, the information with the database, and of the conditions and the prerequisites which have been put in place through the consensus with the stakeholders and scholars in the field. We're talking about the different income deciles and identifying the socioeconomic status of different households, and of course, insurance is incorporated within these determinants. And once we do the cross-checking, and once we eliminate and the overlap, the duplication, and the overlap, we would be able to identify the family who are receiving some kind of support because of, for instance, for food security, We do not wish to have further social assistance from other institutions as well for that specific family. So what we do is we try to actually have more inclusive approach towards all households, and therefore we need to eliminate the overlap. And then there's of course the eligibility testing uh, of, to realize whether the household they are eligible for receiving native assistance. And with respect to the importance of malnutrition, our deciles are 1 to 7 or even 1 to 5, although a lot of the services which the government usually for 1 to 3. But because children are very important for us, we have actually increased the deciles from 1 to 5 or 1 to 7 rather than 1 to 3. And once these cases are checked, the national code, together with bank account, are provided to the central bank. Those whose bank accounts are clear, of course, we will be able to identify the bank account of the caretaker and the guard, the head of the household, and of course, their specific credit cards would be charged. Their debit cards would be charged accordingly. And of course, the Ministry of Health, that this much amount has been deposited into the bank account, and of course, they could refer, households would refer to specific designated shops, and they could do the purchase there. And of course, these shops should be very much accessible to them. We need to pay attention to this because we must emphasize access to the shops as well. So we find the closest that they have a POS machine, and they could use these charged cards in order to take care of their procurement. And of course, we received the final report from the with reference to the importance of evaluation and supervision in these regards. In 2018, of course, we conducted a pilot in the province of Sistan and Balochistan and 7 other least developed provinces of the country who had major problems in terms of food poverty announced by the Ministry of Health. And as reported by the medical universities of every province, which are actually the governing body of health in each province. And many children had been removed from the malnutrition map that existed previously. This shows success for the initiative. Next slide, please, so that we would be able to see. And then, of course, evaluation and supervision is an initiative which is followed up very seriously by the ministry. In terms of food security for children and lactating and pregnant mothers, which is done in close collaboration with the Ministry of Health and Medical Education, it's actually one of the success stories that we have implemented so far, and we intend to, of course, under circumstances, COVID-19 pandemic that our friends and colleagues were talking about, we are trying to consolidate and implement it more robustly. And I'd just like to also add that right now, the 8 least developed provinces of the country have been covered, not just in the pilot, but also the national initiative. We are heading all the 31 provinces, and this is what we intend. I just want to also point out that the UNICEF Foundation and also the Welfare Department, they are 2 major stakeholders, and they're implementing partners in other provinces. I hope that you found my presentation useful. If you have any questions, I remain at your disposal. Thank you.
Thank you very much, Ms. Mirmalek. That was very comprehensive and interesting. I can see we have a lot of questions actually coming in through the Q&A box. We are a bit behind schedule, so I'm afraid we will not have the time to answer them all, but I would like to start and maybe ask the first two questions to the Deputy Minister. The first one would be on the point of non-Iranian children, which was also mentioned in your presentation. So there is a question if you think there are more areas where there's capacity for more cooperation, especially with international organizations like UNHCR. So the question is about extending social protection to non-Iranian children, and if so, how? And then maybe the second question I would also like to pose to the Deputy Minister is from our colleague from UNDP, asking about possible connections between social protection schemes and job generation, and especially if there's a plan for increasing the cash transfers and how the ministry will connect those to job generation schemes. So if I could hand over to the Deputy Minister for your short reflections on these two questions. Thank you.
Thank you very, very much. As for the first question, yes, we can have different kinds of plans and programs for cooperation. We have had different kinds of cooperations with UNICEF. We can also define other schemes and programs so we can work on the malnutrition of non-Iranian children and also their educational status. They might be out of school. We can cooperate in that regard. Even their mothers can receive some sort of protection. They could be put in the center of attention. As for the second question, yes, it was about non-Iranian children too. Yes, we are very much eager to kind of expand these programs and plans. In the past years, we have also cooperated with UNICEF, with other organizations. Yes, we are very much eager to and willing to expand these programs so that we'd be able to take another step in and also curb poverty.
Thank you, Deputy Minister. Would you still like to add anything on the question of job generation? The second question, connecting social protection programs to job generation schemes.
ببخشید من متوجه سوال قبلتون نشدم که بحث اشتغال.
Sorry, maybe I missed that section which was about job generation, but you know, the social welfare and also eradicating poverty is very much, let's say, connected to the job generation issue. And if you want to have different kinds of plans and schemes for poverty reduction, you have to have a good plan of job generation. And as for these programs, we have a different kinds of deputyship in the ministry for that. But as far as I know, I cannot speak on their behalf, but I do believe that they would be also willing to take measures in order to develop job generation programs. But like, for example, if you want to come up with a plan for job generation for the, let's say, poorer people, parts of the population, maybe we would be able to cooperate with us and their department, and also you together would be able to work on that too.
Thank you, Deputy Minister, for your answers. There are a couple of more questions, and I would like to ask Mr. Rostami, maybe if you can come in on those. There is one in terms of how you monitor child attendance within your database, and whether this is done in cooperation with schools. And then I think there's another one that you might want to answer. how do families know their information needs to be in the Iranian Welfare Database so that their eligibility for social protection programs can be checked? And also, what if a family is eligible for multiple programs? Are they informed about that? So Mr. Rostami, if you want to come in on those two questions that I think relate to your presentation. Is Mr. Rostami there still to answer those questions?
Yes, that's right. I guess we'll speak. Well, all of the schools of our country, they are systematically connected with the Ministry of Education. We are within the same network. And at the beginning of the school year, the information of all the school children is registered in the system. When we get this registration data from the schools, and then we cross-check it with our database, because we have the database for the population of the country, entire population of the country. We kind of using their kind of age, information about their age, and those who are in the schooling age, and their names are not in the Ministry of Education database, we know that these people or children are out of school, and then we take the necessary measures. As for your second question, when we identify these children, we come up with a profile for them, and around more than 85% of these children are within the lower deciles of income deciles, and if they are also out of school, it might be because of some migration or change of residence. We give, as I said, we give the information and the data of these families to charitable organizations, and we help them to get in touch with the guardians of these children, and we get the complementary information from the families. And there are also other cases where we have households who want to use our services. They go to our offices in the provinces, and these offices send the information of these families who apply for protection, and then we kind of add this information that to the data that we have, and we relay that to charitable organizations, and then they cross-check and they verify the information that we have provided, and they see what they can do for these children and these families. I hope I have been able to explain the procedure well.
Thank you, Mr. Rostami. Yes, this was clear. I would now like to hand over to the next presenter, actually, and I hope we will still have some time at the end for more questions. Thank you for your answers. Manuel, if you would like to take the floor for 15 minutes for your presentation on the Jordanian system, please, the floor is yours.
Thank you. Thank you so much. And thanks so much, colleagues, for the invitation and giving me the chance to speak a bit about our experience implementing the National Unified Registry in Jordan. Maybe as a starting point would be good to get a sense of the context in Jordan. Jordan is a country of a population with a population of around 10 million people. But the most interesting aspect is the demographic characteristics of the country. We have a country where 63% of the population is under 30 years old, and 40% is below 18 years old. So by default, any social protection strategy or intervention should be looking at these groups, since they are like the core of the population. In addition to that, Jordan, as you may know, have been hosting Syrian refugees, and so far, registered refugees, we have around 670,000 refugees, where more than half of them are children under 18 years old. Then, in terms of poverty, 20% of the children in the country are multidimensionally poor. But when we look into the Syrian population, this situation is worse. I mean, 81% of the Syrian children between 0 to 5 years and children between 6 to 17 years are both monetary and multidimensionally poor. When we look into the socioeconomic conditions of the country right now, we have pre-COVID, the poverty rate overall was around 15.7%. Now, post-COVID, it's around 24%. Then also post-COVID, we have seen a high increase of the unemployment rate. It's around 23%. So basically, the country is facing important macroeconomic challenges. Then in 2019, UNICEF Jordan supported...
Sorry, Manuel, very sorry
Yes?
to interrupt, but if possible, can you switch to the presenter mode? Because we're...
Oh,
sorry.
so sorry.
No worries. So if you can swap the screens.
Yeah, I might need to learn where's the option here. So sorry for the inconvenience. I will stop sharing and reshare. So sorry. What about now? What you see? Hmm?
So it's not in full screen mode. Maybe try again. If it's not working, I think it's fine too. We can see the screen. Now the screen is off again. So if you can share again.
So sorry.
No problem.
From the Jordan side, it's not extensioning from Jordan side.
Now, I will put it full screen. It's okay?
Yes, perfect. Now
okay, so sorry for the inconvenience. So I was saying that in 2019, UNICEF Jordan supported the government on developing the National Social Protection Strategy. The National Social Protection Strategy is the framework of the plans and goals of the government for the sector. The strategy is structured under 3 pillars, basically covering labor market and social security, social assistance, and social services. In that sense, and in the context of we started to assess the social assistance pillar. And what we found that on practice, there was a variety of programs from different sectors with different levels of administration. And each of those programs had its own objectives, requirements, operating rules, mechanisms for selecting the beneficiaries. But then they were sharing, in most of the cases, the same target population without a proper coordination at the time of providing the services. So the consequences of that environment was that there was a lot of duplicity in the sector, programs implemented by different entities, and without this interaction with them. And that was triggering a lot of inefficiencies, but also low impact, the expected outcomes from each of these programs. So what was a possible solution? we thought jointly with the World Bank, and this is something that I want to highlight, that this is the result of a joint effort between the World Bank in Jordan and UNICEF Jordan. We thought that would be good to move into an integrated social protection information system, using the National Unified Registry as a single gateway for all Jordanians that were seeking assistance, and also to use this as a common tool for doing the categorization of the households. I mean, measuring the households based on a multidimensional socioeconomic assessments. So what were the benefits of using this approach? The benefits of using NUR, it would help to increase the coverage and to make it easier for all the households that were seeking support. Also, that increased the transparency and accountability of the programs, because then it was clear how to measure not just the way that they were identifying the beneficiaries, but who was getting what. Then it was evident that it would help to reduce the duplication in coverage across different programs, allowing a centralized oversight for policy, but also for budget planning. And something that it's very important, the NUR, it's also allowing an easier transition of beneficiaries between social protection schemes. So basically, through the NUR right now, we are also able to transition people from the cash assist to the labor market through skills building process and then job profiling and job matching. So this is something that was useful for the graduation process. Also, and very important, increase the impact of the programs by improving and harmonizing the way of doing targeting, and also improving the different mechanisms for coordination, as well as the evidence that is needed in the country in terms of things around poverty and vulnerability. The system was allowing that information. And how we did it. Basically, and this is something that I want to flag and highlight, starting a unified registry, it's very difficult to start from scratch, difficult and expensive. So what we did was to use as a starting point the National Safety Net. The National Aid Fund is the name. That was at that time, I'm talking about 2020, starting a process of expansion. So we used that as an entry point to build the base, to start building the registry. So through the NAF expansion, we created different ways for people to get registered. So we had a mobile registration centers. We were using the offices of the Ministry of Social Development and NAF. We created a web-based registration process, but also through the case management systems of different social protection programs, we were starting this process of building the database. Also, as part of that process, we had to agree on a common structure of the database that will be like the common structure for all the programs, regardless that after that, the programs, depending on their needs, could add more fields to the structure of the database, but at least we agree on a very a specific structure that was common for all the programs. Then, once that process of data validation took place, we do what we call a household assessment mechanisms, which is the process of categorizing or assessing the socioeconomic levels of the households. And here it's where we have, let's say, the child-sensitive aspect of the NUR. Why? Because pre-NUR, the selection for most of the social protection programs in the country was done only monetary poverty as a way of measuring poverty and vulnerability, and also doing categorical selection. So what we did was to transform this formula jointly with the World Bank to include different dimensions: health, education, access to water, then also for people in the informal labor market to create a way of doing the imputation of the income. Then also we established more weights to certain categories in the formula, such as households with children with disabilities, and people with disabilities overall. So in that way, households that met those criteria were getting more weights, and because of that were categorized as poor or vulnerable, and with more other. So once that process of household assessment mechanisms is done, basically the outcome is that each household get a score, and based on that score, all households are ranked. And that is the NUR database, where different social protection programs pick their population. Something that I also want to be clear, and we have to make that differentiation. The NUR, or a unified registry, is not a beneficiary database. It's purely a database where all households are categorized or ranked using a specific targeting or socioeconomical model to measure the levels of poverty and vulnerability, but all households are there: the poor, the vulnerable, the non-poor, and depending on the criteria of the, will pick from there, because we have programs that are, for example, related to employability, that they don't focus on the most vulnerable. They focus on those households that are just above the poverty line, for example. So the programs have the flexibility to pick their beneficiaries. So far, there are 31 institutions connected to the NUR in the country. And on this, I want to emphasize two things. This is a progressive process. It's very difficult to have all the institutions on board since day one. So we have been doing this on phases. And so far, not all institutions send and receive information from NUR. There are some that are the ones that you see on green there, that are the ones that send information to the NUR, but also collect for the programs from the NUR. And there are others that so far are just sending information to the unified registry. Just to give you a sense, this is now how the National Aid Fund, the NAF program, looks like. And as you can see, the National Safety Net, NAF, manage different programs, and all these programs are handled through the National Unified Registry. Something important also to flag are the institutional arrangements. I'm fully aware that the institutional arrangements also will depend on the local context. And honestly speaking, for me, there is no like blueprint or a single model to use. In our case, what we have is 3 levels of, let's say, managing and implementation of the NUR. The first one is a national steering committee, which is basically composed by the Ministry of Planning, the National Aid Fund, and the Ministry of Digital Economy. At that level, it's where the policy decisions as a government are taken. Then there is below that a technical committee composed by technical focal person from each of the entities that are part of the NUR. And here it's where the criteria for operations and the interoperability of the NUR are taken. And then we have the Ministry of Digital Economy and Entrepreneurship. They are the ones who host and manage. They are like the custodians of the NUR. And something very important, they are not involved in implementing a social program. And why I'm saying this, one of the key lessons learned, next and final slide, I will speak about it, is that to get the buy-in and to get the engagement from different institutions, what we have learned is that it would be good to have like a neutral entity that could play that role, because if not, sometimes it's difficult to bring more people on board. Across those three levels, UNICEF, the World Bank, and development partners, we are providing the technical assistance. So finally, some of the key lessons learned from the NUR that could be considered for any country that would like to develop a social registry, it's one, there is no need to start from scratch, to start from zero. Ideally, and it's more efficient to start with the biggest database that you may have in the country. Also, that process, as I said, it's a progressive process. The system needs to get mature over the years. And at the time of building or bringing entities on board, we always need to think as a win-win situation. I mean, we have to offer also advantages for different entities, but also we need to be flexible enough to allow them to meet some of their requirements to roll out their programs. Also, we need to keep in mind that the social registry, it's an outcome for information exchange. It's not the sum of databases, because, and that's why I was saying at the beginning that we need, one of the key steps is to agree on what will be the core structure of the data, not just an exercise of bringing together many databases. Also, the issue of having a unique identifier, it's indispensable to be able to roll out this, and the quality of the information at the starting point also it's determinant. Why? Because, you know, garbage in, garbage out. So the interoperability is another aspect that needs to be worked. The interoperability is that a system that you create to interconnect the different social programs with the unified registry. Right now, the advantage of that is that all our processes are done on real time. So, for example, if one program does an update of the information, in a real time, that information is reflected in the NUR. Also, the issue of data sharing, there data sharing protocols to deal with this sensitive information about the households. And something super important is the legal endorsement. I strongly believe that any initiative related to a unified registry should be supported by legal action that may, let's say, assure or guarantee the continuity and consolidation of the registry over the time. Also, of course, there should be a political willingness to move on with this kind of strategies or systems, because it requires the involvement of all the entities. This is an intersectorial model that, to be able to be successful, good coordination and this willingness for change. So with this, thank you so much. Feel free to ask or put your questions in the chat box. Thanks.
Thank you very much, Manuel, for sharing your experience from Jordan. I would now like to hand over to Samman from the regional office for his presentation and reflections. Over to you, Samman, for 10 minutes, please.
Thank you very much, Charlotte. I'm just trying to find the upload button for the presentation. I don't think I'm able. Oh, okay, I found it. Right, let me know if you see it, Charlotte, and I'm going to put it in slideshow mode now.
Yes, we can see your screen. It's not in
slideshow mode.
Now it is. Perfect.
Okay.
Please go ahead.
All right. Thank you. Thank you very much, Charlotte. And thank you to the colleagues from Iran, MCLSW and UNICEF for inviting me to share a few words about UNICEF's global approach on social protection and also with some examples of what we do in the Middle East and North Africa region. So the presentation will focus on why UNICEF is invested so heavily globally in the area of social protection, what we do and how we do it. So first, just to start off with a recap of why social protection for children is important globally. And as you'll see in this slide, across the world, 385 million children, or 1 out of 5 children across the world, are struggling to survive on less than $1.9 a day. So, living in extreme poverty. Children are significantly overrepresented in poverty. We also heard from the deputy minister, for example, that in Iran, 42% of low-income households have children. So children tend to occupy a higher share of the population living in poverty in any country, and I believe that's the case in Iran as well. But at the same time, also please, we need to remember that for children, poverty is more than just about living under a certain income threshold. Their deprivations across certain dimensions of child rights also constitute what we call multidimensional child poverty. And globally, actually, this proportion of children or number of children living in multidimensional poverty is much higher than those living in income poverty. And, adding to all of these facts, the fact, we also know by now that COVID-19 has actually reversed the progress made on reducing child poverty for the first time in decades. And it's estimated, according to UNICEF, that an additional 100 million children have fallen under multidimensional poverty and more than 60 million children in monetary poverty since the pandemic began. And actually, these trends, if you look at projections, are going to be quite similar in the Middle East, North Africa region as well. At the same time, as Dr. Robin Nandy was saying at the beginning of this webinar in his opening remarks, there are also other trends, macro trends that are affecting children and families. And I'm just focusing on two that are actually quite relevant in the case of Iran, the climate crisis and urbanization. And for UNICEF, we strongly believe that social protection must be designed to also respond not just to underlying poverty and deprivation, but also these macro trends that are affecting and multiplying the poverty and deprivations faced by children. And these are among two of the key ones. Now, what is social protection for UNICEF? And what you see here is actually an interagency definition that has been adopted globally by UNICEF, the World Bank, ILO, and some key agencies working on social protection, basically stating that social protection is a set of policies and programs aimed at preventing or protecting all people against poverty, vulnerability, and exclusion life cycle, emphasizing the need to address vulnerabilities through the life cycle, and with a particular focus on vulnerable groups such as children. Broadly speaking, from UNICEF, we see 4 categories of interventions focused that you can term that are captured under this definition. The first, of course, we heard a lot also about Iran, is social transfers, which is basically non-contributory social assistance, and this can be cash transfers, in-kind transfers, or fee waivers. The second is social insurance, the more contributory mechanisms to pool economic risks across the life cycle, labor and jobs, programs supporting employment, livelihoods for sufficient income, but also, policies and programs that, provide provision and time for quality childcare. And last but not the least, the social service workforce, the social welfare component that underpins, not just the delivery of some of these other instruments of social protection, but also help specifically address social vulnerability. 2 things to flag in terms of UNICEF's approach to social protection. The first is that it seeks to respond to both economic and social vulnerability. As I said earlier, poverty experienced by children is more than just the experience of living in an income-poor household. While we do recognize that addressing economic vulnerability, as there's a significant number of children globally and in the region living in monetary poverty, we do recognize that economic vulnerability needs to be a very central plank of social protection. But at the same time, we also need to remember that children can be affected, and families can be affected by social vulnerabilities due to their personal characteristics ranging from age to gender to disability, and how this status interacts with social dynamics and discrimination. And already we saw in the presentations on the Iranian social protection system how social vulnerabilities are also taken very strongly alongside economic vulnerabilities in designing their instruments. The third thing to flag in this slide is the concept of universal and rights-based social protection that UNICEF ascribes to. I will speak to this at the very end as well in terms of the how. But the key point I want to stress is that we strongly believe in addressing vulnerabilities across the life cycle, meaning that the specific needs of children, in the first few days of life, the first 1,000 days, is going to be quite unique. For example, from vulnerabilities they face in the 11 to 17 years of age group that they're in. So the focus in the earliest days will be much more about health, nutrition, and parenting, versus 11 to 17, which will have a strong focus on education, information, and so forth. So when social protection schemes are designed, when child-sensitive social protection systems and programs are designed, they must be designed to reach all children in need, and addressing economic and social vulnerabilities and factoring in life cycle considerations. Now, globally, this slide shows us, the gap in social protection coverage for children and families. This is from the ILO's latest World Social Protection Report, and you will see in the oval, part highlighted in terms of effective social protection coverage for various groups of the population. You will see that the coverage for children is actually, among the lowest. And basically what this means that only 1 out of 4 children globally are covered by social protection across countries. And in fact, if you dig deeper into this statistic, we will see that the coverage is actually lower where child poverty is in fact higher. So this calls to attention the fact that, focusing on ensuring, expanding and improving social protection for children is a top priority globally. And in fact, in our region, if we look at the statistics, the situation is quite similar. So what is UNICEF doing about, the situation that I've just spoken about? The thing I want to flag here is that in 2019, UNICEF launched its new social protection strategic framework. Actually, this builds on a social protection framework that we had initially developed in 2012, but because there's been such a significant expansion of social protection in countries across the world since 2012, it was felt that having an updated framework and a strategy would actually be more relevant for the world that we live in. And added to this, also the fact I mentioned earlier about the new threats and trends that we witness also called for more attention to a framework that speaks to these threats and trends that are most relevant today. So there are 2 documents as part of the UNICEF framework launched in 2019. The first is the framework itself, and then the second is a companion tool or a companion guidance, which actually shares examples of activities, tools, and provides resources to support the implementation of the 10 areas that UNICEF works on social protection. So the 10 areas that we work as UNICEF globally on social protection are on this slide. They are basically clustered into 5 pillars, if you will, ranging from evidence to policy, and coordination and financing, to specific programs focusing on children or making programs more child sensitive, ranging from social assistance to the social service workforce, and then a specific pillar around administrative and integrated delivery systems, including social protection information management systems, such as the one that was just presented for Jordan. And the last, actually, which is quite also relevant in the case of Iran, is a specific focus on shock responsive social protection, given the intensity and recurrence of shocks that we see in today's world, in our region in particular, but also in Iran. I've highlighted in green or circled in green the areas where in Iran already engaged in supporting various efforts around social protection. So as you can see, there's 6 areas where Iran is already making good progress in terms of improving social protection for children, ranging from undertaking poverty analysis to expanding and improving cash transfers for children, as we saw from the presentations from the colleagues, connecting these cash transfers to information, knowledge, and other social services, strengthening the social service workforce, strengthening integrated administrative systems, and strengthening the shock responsiveness of systems. Overall, what UNICEF believes in terms of what should child-sensitive social protection systems offer every child can be clustered into 3 categories. And this relates to the point I made earlier about addressing both economic and social vulnerabilities and meeting specific life cycle needs. The first is that we believe every child should live in a household with sufficient financial resources to develop and fulfill their. Secondly, we believe that they should have access to quality basic services and the knowledge needed for their development, regardless of income or personal characteristics. So again, going back to the issue of social vulnerabilities. And last but not least, we feel that effective social protection for children should also ensure a social welfare component very strongly, where there is direct contact with a social or outreach worker when needed, who can then help support the responses that families and children need. Now, in terms of why child-sensitive social protection matters in a broader sense, this is just one slide to showcase that actually in the SDG agenda, there is a specific focus under SDG 1 and a target, in fact, in terms of social, expanding social protection as part of as a very central plank of the SDG agenda. But remember that integrated social protection also means that it's an accelerator towards achieving many other SDGs, some of which are highlighted here. Now, globally, this is a slide to showcase, the range of areas that UNICEF as an organization is engaged in supporting countries across the globe in various areas of the social protection agenda, of their social protection agenda, and across those 10 action areas that I highlighted earlier. So, for example, we're involved in supporting child poverty analysis or evaluations and policy coordination and financing efforts in over 100 countries worldwide. We're engaged in helping countries to expand and improve coverage of cash transfers in over 80 countries. We're involved in strengthening integrated administrative systems for social protection in over 70 countries, and we're involved in supporting improving the shock responsiveness of national systems in almost 80 countries worldwide. And this is latest data from UNICEF reporting that we have from 2021. In the Middle East and North Africa, just a few words to contextualize what we do, from the global picture to what we do in the region. Actually, social protection has been recognized as one of the top 5 priorities, programmatic priorities for UNICEF across the Middle East North Africa region. And we call it we call it actually the social protection accelerator, this priority, in terms of making it a top focus of our programmatic efforts in the region. Broadly speaking, under this this program of acceleration, there are 4 pillars that we support countries, or we focus on supporting countries, ranging from evidence and advocacy to policies and coordination to strengthening delivery systems and capacities to improving financing for social protection. And as you will see, we're engaged in this agenda across many countries in the region. In Oman and Tunisia, for instance, work we did around child poverty or simulating child poverty has directly fed into policy responses that have been enacted or social protection responses, reforms that are being undertaken by these 2 countries. The same for Jordan, and I think Manuel also referenced this earlier in his first slide. In terms of policies and coordination in Iraq, Oman, Lebanon, and Sudan, UNICEF has been, with partners such as the ILO and the World Bank, very much at the forefront of providing technical assistance in reforming social protection systems, including the formulation of national social protection strategies. And there's a huge range of efforts actually that are focused on the 3rd pillar in terms of delivery systems and capacities, ranging from Tunisia to, of course, the work that we're doing closely with MCLSW in Iran, and also to humanitarian contexts like Yemen and Syria, where UNICEF has been, making very specific efforts to improve targeting of social protection for children, and Jordan is another example of that, and to actually roll out integrated social protection programs that take into, account the specific economic and social vulnerabilities and the life cycle needs of children. And I should add there that, one of the things we, have very specifically focused on is improving both the coverage and outcomes of social protection for children in their earliest years, in terms of the 0 to 5 age category, because we have found in the region that this is a significant area where there's a gap in terms of social protection programs for children. So it was very heartening to actually see 2 examples from Iran that focus in this specific area. And also in terms of financing, we work very closely with countries to both understand the macro context of, where the socioeconomic context and the public finance context of the situation is, to identify options to attract sources of social protection financing, such as the work we do in Oman, but also work on what I call the micro aspect of developing a financing strategy, in this case in collaboration with the World Bank, to support the rollout of specific programs. So I will end my presentation with a recap of the 4 key principles that guide UNICEF's social protection engagement globally, but also in the Middle East and North Africa region. The first is we strongly believe in universal social protection, but in the progressive realization of universal coverage, because getting to, achieving the rights to social protection for children requires context-specific approaches to getting there. And there is no one size that fits all, and UNICEF does not believe in that sort of formula. So we strongly believe in working anchored in the local context, but then bringing in best practices globally and from global and regional experiences to help inform what can be a good approach nationally. And that leads me to the second point, where we firmly believe in helping strengthen national systems and leadership. In some cases, in humanitarian contexts, yes, UNICEF also works in direct implementation, but by and large, and primarily, our focus is helping and develop national systems and leadership for social protection to improve social protection for children. In terms of the thematic approach, we very much believe, as you've seen throughout my presentation, in integrated and inclusive social protection that addresses economic and social vulnerabilities and specific life cycle needs. And last but not the least, in anything we do on social protection, at any stage of the life cycle, in any country globally, we are guided by the best interest of the child across design and implementation aspects of social protection reforms. So that's it from my side, Charlotte. Thank you, colleagues, for your time and attention, and very happy to take any questions. Over.
Thank you, Samman. No, thank you for this presentation of UNICEF's work on social protection. We are a bit over time, but I got the information that we can go up to 5 minutes beyond the schedule. So we have a couple of minutes. And I would like to take on maybe Robin's question to Manuel. Manuel, if you could expand a bit more on the feedback system and complaints mechanisms in Jordan, please, just very briefly.
Yes. Here in Jordan, we have what we call accountability for affected population, which is basically the grievance and redress mechanisms. This is crucial to be successful in the implementation of any social program or a social registry. The way we have built this system is using basically 4 channels of communications for the citizens. Can be beneficiaries or non-beneficiaries that would like to have different kinds of claims, complaints, questions. So basically the communication channels that we have are, we have a system called Rapid Pro that we use for 2 ways communication through SMS, and now we also have it on WhatsApp. We have a call center, a helpline, where there is a group of agents that are available to provide the answers, but all those agents have access to the system, so they can provide an accurate information. Then also, we have the possibility of put in any kind of grievance through the website. I mean, there is a web access. And then the fourth communication channel is at the field offices of the different social protection programs. Something very important. On this, at the time of building a grievance and redress mechanisms, there are like two areas to be considered. One is that we can call the technological aspects of it, that all the solutions are available, like the ones I mentioned. But then on the other hand, it's very important to establish a very clear processes and procedures for all the different types or possible claims, complaints, and grievances that may come. So that's the first step to do. And then you can move on building like the technological solution. But finally, this is one of the most important things that needs to be in place to have a proper and efficient system. Thank you.
Thank you, Manuel. Thank you. Dear audience, I believe we are at the end of our webinar. I'm aware that there are some more questions in the Q&A box to our colleagues in Iran, but we will try to get the answers in writing and share with those who asked them. And I would like to thank again the Deputy Minister and all colleagues at MCLSW for their presentation, for your time, but also to our UNICEF colleagues for your presentations and support in the organization. Please, if you can answer the survey, that will also be shared via the chat box. And also, if you are not yet a member of the socialprotection.org platform and are interested in other webinars of this type, I invite you to join and to become a member. And with that, we'll close the webinar here. Thank you very much again to all speakers, and see you in our next webinars. Bye-bye.
Bye, thank you.
Bye.